Kągi, kviečiam visus sugrįžti į salę ir patogiai įsitaisyti, nes patiem kantriausiam prizas ketvirtasis plenarinis posėdis. Ir noriu iš tikrųjų priminti ir paprašyti, kad visus, kurie
everyone who's listening to interpreting through the headphones, if you want to talk to your colleague, don't forget that you have headphones on your head, because you start speaking very loud and then it's very difficult for everyone else to listen to you. So don't forget that.
Kągi, tuomet pradėsim ir norėčiau pakviesti.
I would like now to give the floor to the first speaker, Lina Laukaitė, who's the head of Public Health Office and in Marijampolė, and she's going to talk about the experience of public health offices in doing the prevention of bad habits among young people.
Labą dieną visiems susirinkusiems.
Good afternoon, everyone. We have communicated with the majority of you during the breaks. We had a conversation, and I'm very glad that we still have the audience. First of all, thanks to organizers for the invitation to introduce the activities of public health offices in the area. I would like to thank my colleagues, the heads of public health offices, the chair of the association, for sharing experience with us, because public health offices have a possibility to, by taking into account the local situation, to organize a little bit different activities. So the experience of public health offices in preventing bad habits in youth. Taking into consideration that the conference is attended by foreign guests, I would like to present the offices themselves, what public health offices are. They are municipal budgetary public health care establishments, fully or partly funded by the Lithuanian National Health System from the municipal budget. So we are a municipal budgetary establishment, and the main sources of our funding is the state budget and municipal budget. The main areas of activity of public health offices are the organization and provision of healthcare services regulated by the laws and other legislation of the Republic of Lithuania for natural and legal entities within the territory of the municipality or in the territories of several municipalities. So briefly, they perform health care services and functions. Since 2014, since next year, they will not be independent municipal entities, but they will perform a delegated function. Certainly, the range of activities is really broad. We cover various topics and perform various activities. Today, in Lithuania, we have 60 municipalities. In 33 of them, we have public health offices. And these offices supervise healthcare in these municipalities. For another 25 municipalities, provide health care services. the activities of healthcare offices coordinated by the municipal administration, and in case of our municipality is the Department of Social Affairs, and to be more specific, the Service of Municipal Doctors. If I looked at the examples from the establishment I represent, we provide services in Marijampolė municipality and in two other, Kazlų Rūda municipality and Kalvarija municipality. In total, the population of these municipalities is over 80,000. Around 12,000 are of school age, children of school age. Our establishment employs 14 public health care specialists. 12 of them perform health care supervision at schools, so their working place is at schools. They also have other functions, have to perform other functions, many functions. Namely, in the Marijampolė municipality, in education establishments, there are around 8,000 pupils, and our 12 specialists perform healthcare activities, supervision activities in 27 schools. And these functions vary. And one of them is prevention of bad habits. So that's what I wanted to say about public health offices in general, and I will continue with the topic prevention of bad habits in young people. Certainly, as a public sector establishment, we follow closely the legislation and other documents which govern this area, and various methodological guidelines how to work in this area. There are various programs, and some of them are drafted by public institutions and recommendations drafted by public institutions. The majority of them is aimed at educational institutions, but our professionals also take them into account. Since our professionals work at schools together with the specialists of educational institutions, these programs are relevant for us as well. We do not have a lot of employees, so we try to look for partners, and we cooperate with various organizations and institutions. Mostly with educational institutions, where public health care specialists have a possibility to work directly with young people. Personal health care institutions, they are clinics, hospitals and laboratories. We implement various measures when we invite various experts who perform activities in their area. We work with NGOs, with institutions under the Ministry of the Interior, with various communities. Some offices also have partners in other countries while implementing international projects. We are actively involved in cooperation with business enterprises, and I am glad that in Marijampolė we are a partner of Arvi Group, and we are in the premises of Arvi Group, and we cooperate really well with this group of companies. They also focus their activities on young people and on prevention. For example, the Public Health Center of Klaipėda said that 10 partners from different countries implement the project prevention of alcohol and drug abuse. And these partners are from Russia, Finland, Sweden, and Iceland. Nobody would argue that before implementing certain activities, we need to know the current situation. So one of the functions of public health officers is the monitoring of public health. And in this area, while analyzing this situation, we organize and perform various studies and perform surveys of young people. In 2010, we performed the survey of lifestyle of pupils. It is one of the largest surveys in this area. Taking into account the current situation, and as we saw in today's presentations, we see that we still have to work much. We try to implement certain health improvement measures through various methods. Certainly each method has its advantages and disadvantages. The choice of methods is determined by human resources and financial resources and the system which is in place in our country in the area of health care area. So one of the most common methods is lectures and presentations, and these methods are applied at schools by public health officers or specialists. I asked the data from one public institution on the activities performed, preventive activities performed in 2012 through public health offices. So the majority of methods used was lectures and presentations on drug abuse and smoking and health improvement. The disadvantage of this method is low efficiency, but the advantage is access to a large audience. To make these lectures more attractive for younger people, we use various measures like CO2 analyzers, lungs of smokers, and similar measures. A more effective method is discussions. It covers a smaller audience, but discussions are organized with both young people and parents. And it offers a good opportunity to look for arguments for and against, to perform analysis, to compare, to analyze specific cases. While working with parents, we try to find the examples of the best practice, to share them and to look for efficient solutions. Another attractive method for young people, which was mentioned by other presenters, is, and the colleague from Sweden mentioned it, the videos, video material. Viewing of video material and analysis of this video material which is provided for young people. This material, which is prepared methodologically, and our professionals are trained to use it, and we can provide responsible insights and to explain young people how this material should be interpreted. One more advantage is that public health officers look for different material online, and the Public Health Center of Kaišiadorys district sent an interesting video which is produced by a foreign country, but the Bureau translated these videos and voiced them. So these offices are involved in creative work as well, in search for material. And it's interesting, but still requires certain resources, human resources and time. Such videos as alcohol is cool, your choice, they are often used at our work, and we work with this material while dealing with young people. Individual consultations is another method. Our specialists at schools can allocate some time for individual consultations, and it is a possibility for young people to come to a specialist and to talk to them. As all methods, this one has certain disadvantages. According to the programs for training public health specialists, we have restricted competencies, but when a young person needs support or answers to certain questions, the answer could be given by the specialist of the public health professional or specialist. So I would like to say that public health offices in municipalities can provide individual consultations, but today not all offices have human resources for that or competences for performing this type of activities. Therefore, each office chooses whether to provide such consultations or not. One of the most efficient preventive methods are practical sessions. We also use various partners to this end, various experts. All professionals highlight that it's very important to develop social skills and life skills in young people. So educational institutions such as Vilnius University cooperate in these practical sessions with us when developing life skills. We increasingly more public health offices cooperate with the Union of Healthy Lifestyle. Representatives of this union are very enthusiastic while working with young people, and not long ago in Marijampolė we had experts from this union who worked with children. And we performed a project, the Code of Freedom, during which children were awareness was raised in children, their ability to say no was developed, they were taught how to overcome stress. Another methodological measure are campaigns. They are more informational campaigns, but we need them if we want to attract the attention of the society, the attention of young people, and we cooperate a lot with various organizations in this area, with the National Tobacco and Alcohol Control Coalition, with the Kaunas Youth Drug Addiction Center. We perform such campaigns as against smoking, when the CO quantity in exhaled air is calculated. These are the examples from these campaigns. This is the RV company I've mentioned before. They were involved in this campaign. Children at schools do these activities. Another campaign is I Was Born Non-Smoker. On the International Day Without Tobacco, we go to hospitals and we visit babies born on that day and give them as a gift a shirt with a text "I was born a non-smoker." And this project involves a number of municipalities and public health offices. And as a father of a girl who was born this year said that I will do everything to make my girl a non-smoker or not to smoke. We also have a campaign running for sobriety or jogging for sobriety. We also organize various competitions. The competition was mentioned Sober Classroom, a healthy lifestyle, which will start to be implemented in November in cooperation with the Ministry of Education and Science. It's a competition during which attracts a lot of pupils from schools in 4 age groups. Children prepare for practical and theoretical tasks on various topics. And this competition has 3 stages: at the municipal level, at the regional level, and the final at the national level.
Kursų
One of the bigger competitions, which was initiated by the Health Ministry, was and also with the Department of Tobacco, Drug and Alcohol Control Department, and this project focused on the kids from various families, and sports events were organized for the kids, basketball or football events, and this competition has been taking place for a number of years. So we have teams that have been participating in this project for years, and they prepare for this competition throughout the year. And those are the pictures from this event. Those are the pictures from this event when our heart beats together. This is the name of this competition. We also organize various youth conferences when presentations are delivered by young people, and we also speak about the topic of bad habits. And the advantage of this method is that we take all the advantages of young people teaching other young people by looking of information and by transferring information to their peers. And this is the way how they can actually look deeper into the problems, and it's very nice to listen to them and to see their radiant eyes, and to see how enthusiastically they spread information, how they're trying to convince their peers that a healthy way of living is a good one. We're also implementing various programs, projects, such as be independent, live a healthy life, live a sober life. And recently in Marijampolė we have initiated a project towards a healthier choice. That was the name of the project, and this project is enlisted into the program of the government. And the year 2013 in Lithuania is the year of a healthy way of living, and the government also paid attention to that and to their program. So this project towards a healthier choice that was that's delivered in 8 institutions, and these institutions are implementing the project. And today we're now working with teachers in the framework of this project, and also parents can be involved, and we're working separately with children in this project. There are theory and practical workshops. We have meetings 3 times per day. One health school participants on the holistic principle are encouraged to lead a healthy way of living that includes spiritual and physical health. We also work a lot on the dissemination of information. I'm talking about various leaflets, handouts prepared by other institutions and by us, and I'm talking about information spread in public spaces. This is information from Kėdainiai town. So we are organizing the publicity of such information. Public health offices also organize seminars for other specialists that work in preventing area. So these specialists can be teachers, social workers. We are also involved in the activity of municipality decision making, and some offices are less involved, some are more involved, but a lot of offices have organized days of non-smoking. Of course, there has to be very close cooperation with municipality itself. Since we have possibility to work in various structures on the municipal level, those are in drug control councils and councils of children welfare. There are several principles that are the basis of our activity. We emphasize positive things. We are trying to make our activity a complex one, and of course we're trying to show a personal example. Everything would be if everything is very good and nice, we would have very good results. So in order to have public health services of quality, it's very important to reduce the access and supply of substances. It's important to facilitate long-term projects when you can work with the same people for a long period of time. And it's very important to have experts in public health offices who can work directly with youngsters so that they are able to use attractive ways of methods of working with the youngsters. And NGOs are probably very strong at this point. We are also expecting a lot from our delegated function, and we're expecting to have some methodologies prepared. And we are hoping the cooperation of all institutions in this area. Thank you for your attention. Maybe, my presentation was a bit, I hope it wasn't too boring. I was just trying to say what we do, and since there are a lot of activities that we do, I would like to wish us a lot of success in our work. Thank you, Lina, for the presentation. Actually, public health institutionalization shows maturity of the state and understanding of the state that public health is a professional area and we need professionals in this area. And from the presentation we saw that offices have a lot of activities. Of course, we have a lot of expectations from these offices, but I'm sure that they are going to be getting more and more professional because specialists are educated to work in these offices. And now let me give the floor to the last speaker today. Last but not least, and I think organizers left this presentation at the end of the agenda so that people could be waiting for this presentation and sitting in the room. So I'm going to talk about the activity of the young temperance movement, which is called in Lithuanian Valančiukai. So I would like to give. We will hear the presentations about the activity of this temperance movement, and we will hear about their activity in 2 regions of Lithuania. The speakers are Virginia Jonkuvienė and Regina Jadeikaitė. Hello. Okay, so you are probably the most patient ones who are left here. I'm Virginia from Mosėdis, and Regina is from Marijampolė. Why there's 2 of us? This is because we represent the movement of temperance of the entire Lithuania. Why are we going to? Why we heard so many threatening ideas about bad habits of youngsters? Well, at the end, we would like to present you some practical examples, and we will share our good experience. Listening to the presentations, we decided that we're working on the right direction. We are trying to solve the problems.
Valančiukai tai katalikiška organizacija, vyskupo
Our movement is a Catholic organization, and the Bishop Valančius was not only a bishop and a writer, he was the initiator of the sobriety movement, and he was a teacher as well, and he did everything for the young generation, and he wrote books for parents for proper education of their children. So I think that our activities is in itself the true prevention of for children and young people, but to make it flourish, to develop it in Lithuania is our aim and objective. So we will try to share our idea. Our aim is to educate a full-fledged person and involve into these activities the parents, the school community, and health and education institutions and other interested stakeholders.
visur visada ginti dorovinės vertybės, priešinti žalingiems įpročiams.
Unfortunately, the reader is reading the text really fast. So interpreting is really difficult. The speaker has turned off the microphone.
Prasme. Organizacijos nariai, čia tiems, kurie norėtų savo mokyklose ar savo centruose įsteigti, vaikai nuo 7 iki 11 metų, mažiausiai grupelė, paaugliai nuo 12.
The organization's members. Who are the organization's members? The children from 7 to 11 years old, adolescents from 12 to 15 years old, etc. Now, the structure and management of the organization. We have a chain, we have a team, and we have separate groups of people. And the separate divisions of our movement is monitored or supervised by a certain team leader. And one of the ideas is to make young people to change and to be brave to change in the democratic conditions of Lithuania. We work either with young people, teams of young people who could be called the clubs of young sobriety movement members. And this...
Šit truputį lėčiau, nes vertėjai prašo truputį lėtinti tempą, kad spėtų iš...
The interpreters ask the speaker to speak slower. So we're trying to save time to speak slower. So preventive situation in Lithuania. So bad habits, which were discussed already today. We spoke about suicide rate among young people and children, and the AIDS problems as well. Violence, again, is one of the problems, and the violations of law. And the daily problem of teachers, this absence from school. We think that we have a lot of problems, therefore the movement of sobriety and the followers of this movement is the best prevention of drug and alcohol abuse among young people in Lithuania. Now I'm going to speak about Samogitia. And here you see the offices which are available in our Samogitia region. So we have plenty of points which we can access and contact. So we have the Mosėdis Gymnasium. I'm the head of this gymnasium, and I encouraged several other schools to cooperate with us. Some smaller schools simply disappeared from the map of Lithuanian schools. Some of them were not just attracted by this idea, but there were different problems. We found a partner in Akmenė, Mažeikiai, and Kėdainiai Jonava as well. But the majority of the heads of schools shared their concerns that older children just don't want to participate in these activities, did not want to participate in the activities of the sobriety movement. And the primary classrooms from the 1st grade to the 6th grade are the most active pupils. I also have an NGO of sobriety movement, and I think that these NGOs aimed at child activities have not been sufficiently used. Therefore, we have different aims and goals, and we look for various forms to implement them. The major principle is find something new, and these are examples to boost cooperation with neighboring schools, partnership with regions, and Mosėdis performs really successfully in this area. The team activities, dissemination of the best practice, and the possibilities for project activities.
And we start from a very simple temperance movement at schools, and we started in 1997. In 2002, we received first ties, and in Mosėdis secondary school, Valančiukai company was registered in 2003. And when the secondary school became a gymnasium, we had to change our name, and we improved our provisions, and we are now an NGO called Valančiukai.
Aha, čia tiesiog dabar ir įvardėjo, kaip mes vadinamės. Matydami šito...
The numbers are really of children who want to enter our company are really great, and we start from the 5th graders and they can stay up to the 10th grade, and we think that they are going the right way. The life itself is not a bad or a good thing, it's just their location. This is where it's both good and bad lives. And I think that the activities in the big cities have to also be spread in the smaller towns of Lithuania. So we always take care of our Mosedis school Valančiukai, and we always try to give them the same as other children in other cities Lithuania get. And the board of this company and NGO is very important, which involves parents, supporters, and other members. There is a long-term cooperation with the church, with the Mosedis municipality, with the Mosedis museum of stones, with the Mosedis Bishop Valančius museum, and with the Bishop Valančius temperance movement in Vilnius. We have a lot of project activity, and we're very proud of that. And these projects give a lot of possibilities for young people. We organize a lot of camps for young children, and we have projects of different levels. Here I wanted to demonstrate the projects. There are the names of the projects. The project which is called Come to Us and Invite Your Friends. This is when members of our organization invite their friends who are not members of our organization. So that's our members invite their friends, and these friends invite other friends. Another project, looking through the window of childhood. There was a project where we cooperated with parents, and mothers of children helped us. We staged various performances, and tried to work with parents. Another project was summer work and rest camps, and another project was aimed at finding other activities rather than smoking or drinking. Directions of our activity are Catholic, educational, cognitive, and so on. This is the Museum of Stones. We help them to organize traditional feasts, to organize educational events, development of
Senelių namuose į Nasrėnų kaip
community work. We help our partners and supporters, and we help to do the work in the cemetery. We also participate in various days of non-smoking. Artistic self-expression is also very important, so that a child does not look for any other ways of expressing themselves. So we organize various competitions, events, educational prevention activity. So we have a lot of activity in the Museum of Bishop Valančius, and our project activity allows us to organize various seminars. Tourist and cognitive activity. We think that various trips are very cognitive trips are very important for our members, and I also went with a group of 600 Samogitian people to Rome, and unfortunately we didn't see the Pope because he resigned at the time when we went to Rome. So I think we have to go to the trips because we enlarge our experience and good practice from others. Various events of national identity and republic events in Mosedis, and you see all these events listed on the slide.
Ir čia partnerystės ryšiai.
And we have a lot of partners, and there are a lot of opportunities to build partnerships. Of course, we are very far away from other bigger cities in Lithuania, so it has some influence. But however, we are trying to find partners and share our good experience. And those are the picture from the meeting of temperance movement in Plateliai and Mosėdis in Samogitia. So, Regina, over to you.
Na, kiek minučių duodat? 5?
So how many minutes do I have? 5, 2 or 3? And our activities are very similar. I will speak very briefly. Please don't speak very fast, because you won't be able to go for dinner to have, because you will have to be accompanied to your accommodation. You won't be able to leave these premises. We will have to accompany you. Okay, we have Suvalkija and Dzūkija regions. We have over 200 members of the temperance movement. We have a lot of teams in Alytus, in Graukai, Kazlų Rūda, Sartautai, in Šventažeris, Kapčiamiestis as well. We have the strongest group in Marijampolė, and we are very proud of that. And I just wanted to say that we have a generator, an engine. This is the temperance movement of Marijampolė, and it mentors all the activities in schools, but we from educational departments wouldn't be able to get involved much into these activities if we didn't have this temperance movement. And we go to schools, we speak to the headmasters of schools to have these sobriety teams at schools. So we have in Alytus teams, in Liudvinavo school, Gudelį school, and we have a mixed team at Stankevičius Gymnasium, and I am the moderator of this group. But some teams just simply disappeared in a number of Lithuanian times, and it's a very acute problem for us, because we do not have heads who would just organize these activities. Young people now grow up in different conditions, they have different values, and there are no enthusiasts like us among them. We still want to work in this area. We want to inspire young people. When you have this fire in you, when you are burning with these ideas, only then you can work in this area. We can be proud that, for example, our members of our organization do not smoke and do not drink alcohol, and that's why we want to have more people like that, more young people like that in Lithuania, and more teams of these people. But if these people want to try these things, they can't be a member of our organization. The experience of Finland and Sweden is the same. For example, if a small child is educated since the primary school, there is a great probability that this person won't start drinking or smoking at an early age, and the probability reduces with the age. So we want to attract young people, and how to do that? Through various activities. We have to go hand in hand with young people. We have to retain their pace. And what we do, we are engaged in educational activities. We organize conferences, seminars. various campaigns, various readings, project activities, various commemoration events. Marijampolė also has a very good example. We have a common ground with this municipality in Marijampolė because the elderly people and we participate in commemoration events, we participate in reading evenings, in various celebrations. And nobody laughs at older people. These young people are used to spending time together with the older generation. We have a nice tradition of tours or campaigns, and our slogan is a sober nation, a healthy nation, and such campaigns have been performed for 15 years. It was a pilgrim tour. We just go with posters. We also go to various villages. And what is strange, and we sometimes even chant, if you smoke, you kill yourself. And when you go in a small town and you start chanting, if you smoke, you are killing yourself, then these older people in smaller towns, they are sort of ashamed when they see us, if they are holding a cigarette in their hands. And children just notice that, look, this older person just has a cigarette in his hand, so it's make the older generation ashamed. So we acquaint pupils with our native land. We develop their creativity, independence, communication skills, and we organize various trips. We attract people because they like traveling, they like to get to know their native land. We go to the seaside, to Mosėdis. We visit famous sites, and we implement various educational programs. Children are fond of these programs, especially small children. Children produce chocolate themselves. They then eat these chocolate products. And one of the most beautiful activities is the gatherings of children. We have even older children. When the gymnasium pupils participate in different gatherings, and they want to do that, and when they grow up in this environment, they call to us, and when they get older, they call us and they ask whether they can go to these gatherings. And these children, I want to emphasize, they don't smoke and they don't drink, and we are very glad that young people got involved into these activities. We barbecue sausages, we meet gorillas, we organize various theater programs. I was asked again to speak slower. We participate in various exhibitions. Samogitija has a movable exhibition about Motiejus Valančius, the bishop, the founder of the sobriety movement. We had a nice event on opening this exhibition. We also visit museums, various museums in Lithuania. We have various competitions. Children like these competitions, but for me, it was also interesting. I wanted to ask the question to the representative of the Ministry of Science, and why they don't speak about religion. They spoke about ethics and biology, but religion was not there. So our movement is the only one among youth organizations who are involved in spiritual activities. And what is important in this world, in this period of time, just children don't refuse these activities. And they say, and I'm not ashamed to say here that I believe in God, and the members of our organization are not ashamed to say that they believe in God, that they go on tours to pray, that our events start from a prayer, that the great events start from the Mass at the church, and we also participate in the cross, in the road of the cross, when which reflects the path walked by Jesus. And they are not ashamed to say that. I would like to thank, speaking of spiritual activities, because we have the priest Pleuritis from Kozlų Rūda who works a lot in this area. He works a lot with young people, and we also have the spiritual reader of the diocese, Antanas Mickevičius. Thank you very much for your activities and your assistance in this area, because we need your assistance. And young people really appreciate that, and they are inspired by that.
We also participate in roundtable discussions. We participate in the events and the meetings. We also participate. We also cooperate with Scouts, and we have a youth fair, and our members present mineral drinks in this fair. What are the advantages of being a member of our organization? This is developing your activities, cooperation, and the value development. And the problems of our activities is the lack of leaders, and maybe the Ministry of Science and Education would pay attention to that. Organizational structure, we like this organizational structure, and of course money. Financial problems are always the problems. It's just standing to next to me. So the final ideas. We have European funds open for the projects. Our kids want to organize Republic summer camps, and they want maybe some assistance from the Ministry of Education or from Temperance Movement. Our future is to have more children's and youth non-governmental organizations, partnerships with Bishop Valančius.
Nu kasgi aš esu, kai neturiu, kaip prisistatyti.
Temperance movement, and we have to have our divisions in various regions of Lithuania, and we would like to have a stronger Republic center. Thank you for your attention. So maybe I think we exceeded our time. We are very sorry for that.
Padėkoti.
We would like to thank Vytauto Jogelį, who is our patriarch. We started 10 years ago, and he's been supervising activity for these all years. He's our chair, and it's a great honor for us to participate in the same conference with our chair. Thank you very much, Virginija and Regina, for this enthusiastic presentation. And unfortunately, we have very little time, and I think that we will all have the possibility, if you are interested in the activity of this organization, so you will have the possibility to talk directly to these ladies during our dinner. So if you think that you can be the leaders of the Valančiukai organization in your region, so it's a good opportunity to talk to these ladies during the dinner. So that was the last presentation, and the time of the agenda is over, but it would be really bad if if we didn't have any possibilities to ask questions or to make comments. So since I'm chairing this session, I must ask you if you have one or two short questions to the speakers. As I understand, you're all full of information and now you just want to have some rest. So, some organizational information. There is a short question.
Etinis klausėjas yra.
Our constant person giving questions.
Jūs... Jo, negalit. Mano pavardė yra Algirdas.
I'm Algirdas Mačiulaitis. I'm a farmer. I don't work in your organization. I'm here for the first time. So the question for Valančiukai organization. Do you have statistics of how the consumption of tobacco and alcohol is reducing among those communities where Valančiukai organization is active? And another question to Lina Laukaitinė. You were talking about the measures to reduce alcohol consumption. What do you think about such means as TV shows as 24 hours or Farai? Do you think it's a good instrument or a bad instrument?
Tai pirmiausia, vadovės, tik sulaukit mikrofoną.
So first of all, Valančiukai leaders. Well, actually, in our schools we do these surveys, and we follow the lives of our ex-members, so we know how they live. And in the whole Lithuania, we don't have any. Well, we're practitioners, and we live. For us, for our kids, well, we don't have any statistics, and we don't feel the need for statistics. Maybe somebody from above could do that.
Tai dabar Lina.
And Lina, please, the microphone to you. Very simple answer. I think those are very bad TV shows. Those are not the instruments, not measures. Those are the TVs that actually insult our young people. And when it comes to this TV show called Farai, or Policeman in English, I really prompt everyone to find other ways of spending your leisure time so that you don't watch such destructive TV shows. Thank you for your questions and thank you for your answers. And I think that you don't need very huge surveys. It's very well known from other activities that children who are involved in a civil activity, they are they smoke. They don't smoke. They don't drink, and they are psychologically healthier and stronger. So no matter what organization they're involved in, it could be Scouts, it could be Temperance Movement, it could be other organizations. So it gives a lot of advantages to children. So some practical information. At 6 o'clock, we have dinner, which is going to be served here on this floor. We're going to have a buffet, and everyone will be able to have a dinner. And we'll be able to talk to each other for approximately an hour. So I'll see you at 6 o'clock in the same floor, on the same floor. Now, when it comes to tomorrow, I'll give this. Do you have anything to add? So thank you for your patience and a productive day, and I'll see you tomorrow.